Hi everyone, myself Dr. Akash Mangukia and I welcome you to my channel after very long time. And today we are gonna see what it looks like to work in the ICU as a medical officer in the night shift. So basically I go to hospital at 9:30 and my shift starts at 10 p.m. From my work to the hospital distance is like around 9 kilometers. So I take usually 10 to 15 minutes to reach to the hospital. So my shift is really depends on the day. Sometimes it is in the ICU, sometimes it is in the ER, or sometimes it is in the general ward too. So today my shift is in the ICU and I'm gonna show you how it looks like. After reaching to the hospital, I directly go to the ICU. I reached to the ICU and I saw 4 patients. 2 was for severe stroke and 2 was for breathlessness, and they were on the CPAP machine. There is 11 bed in this ICU, and I don't know, 2 or 3 days ago there was no space in this ICU, like all beds were occupied. In that night I had 1 patient intubated, 3 patient was on CPAP, 2 patient was having the severe stroke, the same patient I'm having today, and 2 patients had post-plasty. Post-plasty means they put stent into your coronary arteries and they are kept in the ICU because we need to observe them overnight in the ICU, that how the stent is behaving, because sometimes after putting the stents patient usually gets lower BP, and if patient gets lower BP that stent tends to close. So we need to monitor that patient BP doesn't fall and the stent will not close. So we have to keep the patient overnight in the ICU after doing the plastic. And in the night I have to stable the patients, like if the patient have high BP I need to stable the BP of the patient. Like I said, if the patient is intubated I need to keep monitoring that patient's BP doesn't fall, patient is oriented all the time, or patient is not going into the hypoxia. So after coming into the ICU I need to see all the vitals and all the complaints of the patient and write it down in the notes, and I have to give the medication, I have to write the medication and everything in the night, because in the morning when the doctor comes and he needs to change the medication, he needs to see that what medication is going on. So I really go quickly to all the patients and write down my notes, and then after writing down all the notes I go to each patient and I really look down the file and see the all procedures and which procedure has been done today, which medication has been given today, and which complaint patient had today. So right now I'm going into the ward to help my colleague. This usually doesn't happen if the patient flow is more, then we exchange and we go for help and everything. So I have to go down there and help. Meanwhile, if something happens in the ICU, the sister will directly call me that this happened, and I will directly rush into that floor. And one thing I forgot to say, when I write down the note I also have to write down the investigation that patient needs tomorrow, because when cardiologists come in the morning for the round, cardiologist needs to see that what changes has been happening to the blood test because of this and that medication. So after helping to my colleague I came back to the ICU and done my all the work, and at 1:30 or 2 I directly head to the doctor room to rest myself, because at that time all patients were stable. And suddenly at 5:15 am sister comes rushing to me and saying that patient's rhythm in the monitor is changing, and I rushed myself to that patient and saw that patient is going into the VT. VT is ventricular tachycardia, in which patient will have around 200 to 250 heart rate, and that is not good. So usually our heart rate is regulated by SA node, which called the pacemaker, which is natural pacemaker. So sometimes that SA node and the ventricular muscle doesn't coordinate, and ventricles will have their own rhythm. So that can be end up into the ventricular tachycardia. And I quickly started doing the CPR, because in that situation ventricle cannot fill properly or cannot contract properly, and patient's cardiac output can fall. So we have to pump the heart from outside of our body and give the blood flow to all vital organs. And from those vital organs the brain is really important, because if you have less blood flow you can have hypoxia and you can go into the coma state. And I started doing the CPR and told sister to charge the cardioversion machine at 100 joules, and then I grabbed the handles of the cardioversion machine. One pedal you have to put it on the sternum and one pedal you have to put on the ribs, like here. You have to clear the bed to give the shock and say clear, and you give the shock. As soon as I give the shock, rhythm started to change little bit, but it didn't completely come into the sinus rhythm. And after that I did half minute of CPR and sister charged that machine again, and I again gave the shock to the patient of 100 joules, and then that patient's rhythm start coming into the sinus rhythm from 200 of heart rate to 70 heart rate. So I have given the primary treatment to the patient, but patient can go into the ventricular tachycardia again. So I have to prevent that. And for that I gave MgSO4 state and lidocaine infusion to the patient. So in this monitor you can see the ventricular tachycardia rhythm. Our heart rate doesn't look like this. So this is just irregular lines and this is called ventricular tachycardia. And after that episode, patient went into the ventricular biochemistry. And after some time that lidocaine and MgSO4 effect starts to kick in and giving the result, patient comes into the sinus rhythm. And after that I went for a little rest and woke up after half hour and I see the light coming inside the window. And when I woke up in the morning, all patient was stable and my duty was about to finish. So my duty was about to be finished, and when morning duty doctor comes, I need to tell all these situations or all these events to that morning duty doctors, so that doctor will get oriented to do all the patient. So after giving all the over of all the patient, I left the hospital, and this is the morning view of the hospital. So this is how my job looks like in the ICU in the cardiac hospital. So let me know in the comment section that which part of the video you like the most, and I hope that you enjoyed this video. And if you enjoyed it, then hit the subscribe button down below and give the like button to this video, and I'll see you in my next video.